Ever wondered what hepatitis B is and why it's such a global health concern? Let's dive in. Hepatitis B is a liver infection, but not just any infection. It's caused by the potent hepatitis B virus. Now, this condition can manifest in two ways, either as an acute short-term illness or as a chronic long-lasting disease. But here's the kicker. Both forms can lead to severe complications like cirrhosis, which is scarring of the liver, and even liver cancer. Yes, a tiny virus can cause such havoc, and it's not just a handful of people who are affected. Hepatitis B is a global burden, affecting millions of people. The Western Pacific and African regions are hit the hardest, bearing the highest rates of infection. So that's a brief introduction to hepatitis B. But what causes it and how does it spread? Understanding the causes of hepatitis B is the first step towards preventing its spread. This liver infection is caused by the hepatitis B virus, a cunning adversary that can survive outside the body for up to 7 days. The virus spreads primarily through contact with infected body fluids. This could mean exposure to blood, semen, or other bodily fluids from a person who already carries the virus. The transmission might occur in several ways, such as needle stick injuries, which are particularly common among healthcare workers, or through procedures like tattooing, where equipment is not properly sterilized. Another way the virus spreads is from mother to child during childbirth. This is particularly concerning because infection in infancy or early childhood often leads to chronic hepatitis B in about 95% of cases. Lastly, let's not forget about sexual contact. Unprotected sex with an infected person can indeed transmit the virus, making safe sex practices crucial in preventing the spread of hepatitis B. Now that we know how hepatitis B is transmitted, let's look at the symptoms of this disease. Hepatitis B can be a silent invader, with many people not experiencing symptoms when newly infected. However, when symptoms do occur, they can be quite varied. During the acute phase, they may resemble flu-like symptoms including fatigue, fever, and nausea. As the infection progresses into a chronic condition, individuals may experience more severe symptoms like jaundice, a condition that turns the skin and eyes yellow, dark urine, and abdominal pain. Diagnosing hepatitis B involves several steps. Healthcare professionals typically start with a blood test to detect the presence of the virus. This test looks for certain antigens or antibodies produced by the body in response to the virus. If these are found, additional tests may be conducted to evaluate the severity of the infection. Liver function tests, for example, can assess the health of the liver and indicate if any damage has occurred due to the virus. In some cases, a liver biopsy may be performed to further evaluate the extent of liver damage. Diagnosing hepatitis B is crucial for timely treatment. But how is hepatitis B treated? Treatment options for hepatitis B have evolved over time, and while there's no complete cure, the disease can be managed effectively. When it comes to tackling hepatitis B, oral antiviral medications play a significant role. These medicines work to slow the progression of the disease and reduce the risk of complications. However, it's important to note that in some cases, lifelong treatment may be necessary to manage the disease effectively. The hepatitis B vaccine is an indispensable tool in preventing the disease. Offering nearly 100% protection, it's recommended for all newborn babies. This vaccine provides long-lasting protection and is a crucial step in the global fight against hepatitis B. For mothers who are carriers of the hepatitis B virus, there's an additional precaution to prevent transmission to their newborn. This involves the use of antiviral medicines during pregnancy. It's a preventive measure that is shown to be effective in reducing the risk of mother-to-child transmission. But let's not forget, the fight against hepatitis B isn't solely about treatment. It's also about implementing safe practices and regular checkups. This includes avoiding direct contact with infected body fluids, practicing safe sex, and regular testing for high-risk individuals. Remember, prevention is better than cure. Vaccination, safe practices, and regular checkups are crucial in the fight against hepatitis B. In conclusion, hepatitis B is a serious liver infection with global implications. Originating from the hepatitis B virus, it can be transmitted through contact with infected body fluids, often from mother to child or via infected blood. Symptoms may not be immediate, but chronic conditions can lead to liver failure, cirrhosis, and liver cancer. Diagnosis is crucial, and treatments range from oral medicines to vaccines, which offer nearly complete protection. Remember, knowledge is power. Stay informed, stay safe. Together we can combat hepatitis B.